I've been working in China for 10, 12, 13 years, on and off on various projects, 3 or 4 different hospital development projects, 1 or 2 of which have done well, 1 or 2 of which haven't. And I've learned from all of them. I've also had the opportunity in recent years to be teaching at Tsinghua University, which is up in Beijing. It's a top university in China. And I've worked primarily with a health economist there from their School of Commerce. And he taught me a lot about what was going on in China. Likewise, I would tell him about what was going on in the States. And we sort of go back and forth all the time. So a lot of the thoughts you're going to hear today are really just about that. That is his thoughts. And I guess the bottom line I want you to appreciate is that we have a tendency here in the U.S. to think of healthcare in terms of its costs, how expensive it is. It takes maybe 18% of our budget. We have a tendency to totally forget about the benefits of healthcare. And I'm not just talking about life expectancy and morbidity and things like that. I'm talking about it from an economic standpoint. The United States is blessed with a lot of economic development from the health industries. And I was just writing down a couple companies: General Electric, Philips, Medtronic, Amgen, Johnson & Johnson, Pfizer, Merck, Gilead, Regeneron, Eli Lilly, Abbott Labs, McKesson, and we have a couple companies here in Colorado, Stryker and DaVita. These are all large multinational companies, and they are doing very well in the world, and it brings tremendous economic development. Our economic engine in the United States is heavily driven by these health industries. The reason I mention this is the Chinese get it. They want healthcare today, not just in terms of being a dividend for what's happened with their manufacturing sector and how well it's done over the last 20 years as a way of giving back to their citizens in terms of better health services, but they also need economic development. And they realize the engine of economic development that has been brought to the United States from the health industries has been fantastic. So they are investing heavily in healthcare, not just in health services, but also all the other health industries, medical devices, insurance, pharmaceuticals, biotech, etc. Now, why do you think they might want to especially go into health services, that is, as hospitals? The hospital industry is the most labor-intensive industry in the United States. About 60% of costs in the hospital are labor costs, okay? Now, what is the greatest need in China today? Jobs. They need jobs. What's going on in China and has been for the last 20-odd years is the greatest migration in history of all these people coming from the west to the east, these large cities. I think there's over 50 cities with at least 1 million people in them in China. They need jobs, and they needed jobs yesterday. They are looking at healthcare, and especially health services, hospitals, as a way to generate even more jobs for all these people that are coming over. And I'll give you one example. I was with a corporation in about 2008. We were in a hospital in China, a big hospital in Shanghai, and we went in, we had this IT system that we could put into place, and the person that was trying to sell it said, listen, what you got going on here doesn't make any sense. You need IT. And I'll tell you one reason you need IT. We can get rid of 30% of your employees tomorrow just by making things a lot more effective and efficient here. And he said, no way. We need every job we can get here. So we have no interest in your IT situation. Okay? So what I'm trying to say here is think of healthcare as not just a cost, but a benefit. And in terms of economy, it's a tremendous benefit, as we've seen here in the States. I should, put it also in the context of the United States. Since 1988, every single month, since 1988, except for 1 month, there has been an increase in jobs through the health industries in the United States. In 2008, when our economy went south, over 50% of jobs that were created in the United States came from the health industry. So I'm trying to tell you, it's working in the United States. Chinese and other countries too, India, etc., are very aware of what an economic driver it is for the U.S. economy. They want the same thing. And what I'm going to be focusing on here in the next 45 minutes is basically the health services sector, not just, say, pharmaceutical and medical devices where we already have the multinationals, but the health services sector. Because the health services sector, what I mean by that are payers and providers, hospitals, etc., is late in the game of going international. Pharmaceuticals and medical devices have done this for 30, 40, 50 years. Health services is just now starting to internationalize, especially since the passage of the GATS Treaty in 1997 that allowed for services to go across borders and getting rid of tariffs and things like that. So now you're hearing a lot about medical tourism, and you're hearing about hospitals in other countries starting to become accredited for, say, JACO accreditation, JACO International accreditation. They're trying to come up to world-class standards. So that's what this talk is. It's sort of feeding into that. So, just give you a little bit of a primer on China. My guess is you're aware of all this. Today they're the top energy consumer. They became the top energy consumer last year. That means they also are the top in terms of carbon emissions. They do a lot of their energy consumption through especially coal products. Top in foreign reserves, top savings rate. This is a problem for the Chinese. They're trying to get their citizens to be much more consumer-oriented. They still are the top manufacturer, therefore the top exporter. And I just want to throw in this one, they're also the top executioner. So there are some personal freedoms that are still lacking in China. This next slide and the information I have is from Dr. Richard Drobnik from the Marshall Business School at the University of Southern California. They have a leading China center there. He spoke at our campus, the Downtown Business School campus, last year. He reminded us that although every American company wants to get into China, after all, there's 1.4 billion people in that market, that really, in effect, not too many are doing that well. Now, these numbers are a little bit old. You could see, for example, Apple here, 51%. This is before the iPhone 6 really took off. And you might have noticed their fourth quarter results were basically primarily on iPhone 6 sales over there. But you can see the companies that have done well there. What I think is more important is that only 67 American companies were seen as profitable by 2012. So the Chinese want American products, especially top American products like Apple, like Coca-Cola, like Walmart. They want them there, but for many other companies, smaller, mid-sized firms, it's been difficult to get into China. And there have been a number of reasons for that. I'm not going to spend a lot of time on this slide. You can see the intellectual property rights problems, human resources. Do they really have the capacity in China to manage American companies over there, et cetera, et cetera. So, and also the Chinese have a tendency to control their economy. They don't want us coming in there and taking over certain industrial sectors. So there's going to be limits as to who's going to do well and not. Now, actually, let me back up a little bit. When it comes to healthcare, as you'll see, the Chinese are pretty far behind when it comes especially to allopathic or Western scientific medicine-based healthcare. The traditional Chinese medicine, of course, is very rampant throughout China. And what they're doing is they're allowing American firms in very easily. There's a joint venture agreement that has to be signed for any American corporation where approximately 51% of the equity and ownership of the company has to be Chinese. So that's how you enter China if you're, say, Motorola. Okay? In healthcare, that stipulation is 30% because they're trying to entice American health corporations into China. And in some cases, it's actually 0%, where you can put a whole greenfield approach in there because you offer something that they really need, such as oncology care. So there's a real need for cancer, but there's also a need for many other things. Here's the Chinese medical history. I'm going to try to do this in 2 minutes. It's really not a fair way to approach it, but the U.S. has had quite an imprint in China, believe it or not, starting in 1915 with the development of the Peking Union Medical School through the Rockefeller Foundation. Skipping all the way up to 1949 when the revolution happened. They started the barefoot doctor system. Actually, they started a little bit later than this, but this is when Mao came in. And then in 1965 to 1975, we had the Cultural Revolution. Unfortunately, this put a lot of things backwards in terms of medical education, et cetera. You can look here at the number of doctors in Shanghai. Before the Cultural Revolution, there were over 10,000. By the beginning and then into the middle of the Cultural Revolution, there were no doctors, arguably, in Shanghai. So they had to start it up. Again, Deng Xiaoping came in 1979. This is when we started to go to a market-based economy, and we started the medical schools, and they're still trying to catch up as a result of all of that. So that's a quick primer. Government spending on healthcare in China has always been remarkably low. They haven't had a high valuation for medicine because it hasn't produced a lot of the results that we might see here in the West. So government spending was only, as of 2010, $200 per person. Okay, this is quite different than what we expect in the United States. Healthcare expenditures as a percent of GDP are quite different from the U.S. And this is effectively what it looks like in terms of per capita, per person, spending on healthcare in China as of 2010. Now, what does this tell you as a business, especially as a business that's in the health services industry? It tells you probably don't have a market in China. They don't spend money on healthcare. How are they going to be able to afford Western healthcare technique? So and a lot of this has to do with subsidization and other things, but basically there's a lack of legitimacy for Western healthcare. This is changing quickly. As we have a middle class and upper class developing in China with more disposable income, becoming much more familiar through the internet and TV and other things, of good Western healthcare techniques that could make considerable differences in their life, and they are starting to demand Western healthcare techniques. Last year, over 60,000 Chinese flew to Taipei, Taiwan for their healthcare. Now, the Chinese government is not happy with that. They want their citizens to stay in China to get healthcare. So they want good hospitals in China. So people not only stay in China, but maybe ultimately come to China for healthcare. Same thing down in Hong Kong. There was a good article in the New York Times last year. People were flooding the hospitals of Hong Kong for maternity care. Why? Number one, they have a one-child policy in China. So if you're going to spend money on healthcare, at least spend it on the birth of your child. Let's go to Hong Kong. Why to Hong Kong? Because they have a British-based hospital system. They're afraid of going to Chinese hospitals. So this is going to change over time. This is the reason the Chinese government is welcoming Western concerns to come over there to pick up the pace in terms of world-class medical care and bringing in better hospitals. Here's Shanghai. This is, where did I get this? I think this was from a McKinsey report. But basically, look at what they spend on healthcare in Shanghai. Basically, they spend more on clothing per year than they spend on healthcare. So this is once again reflecting the idea that they don't value healthcare, especially to the extent that we do in America, but most other developed nations. This will change, but it's going to take some time. Okay, here's health reform in China, 2009. Once again, the economy's done very well. They want to give back something to the Chinese citizens. All of a sudden, in 2009, especially in the urban areas, all workers and their families were put into a social insurance product, and all of a sudden they went to universal coverage. This is a few years before we started the Affordable Health Care Act here in the States. Now they have universal coverage in the cities. It's sort of catastrophic here with high co-pays. We do have also health care in the more rural areas. Here people get subsidies of $2 to $3 to $4 per year per person. Apparently that covers their health care needs. So they went from a pay-for-service system to universal coverage in 2009. This is evidence of how they are starting to build up their health care system. So they are adding more facilities. They are renovating the old facilities. They're bringing in top-level medical device equipment. They're bringing in top-level pharmaceuticals of the essential drug package. That is the drug packages that hospitals have. Remember, these are all government hospitals. Of the 400 odd drugs that are in their formularies, almost 50% of those drugs come from American multinational corporations like Pfizer and Eli Lilly. So they're recognizing that we're bringing in good products. They're willing to pay the price. They're trying to bring things up to speed. Here's the per capita health expenditures as of 2011. Here we go to universal coverage, percent with health insurance in the bottom line. By 2020, they expect to more than triple what they've spent on healthcare. That's a quick amount of spending on healthcare in just 9 years. So they're trying to get themselves up. And I just basically took the previous graph and sort of simulated China as it goes up by 2020. They're trying to get above the spending they have in a much poorer country like Vietnam, trying to get up above Thailand and get closer to what South Korea and Taiwan offer for their citizens in terms of healthcare expenditures. It's going to take time, but they're moving in that direction. Here's the expanding service sector. This goes back to my initial argument that they need jobs. And where are they finding jobs? They certainly can find them in healthcare, especially health services, which is very labor intensive. But this actually has a lot to do with the whole service sector. Manufacturing, they're starting to lose some manufacturing jobs at places like Cambodia and Laos and Vietnam because they have good employees down there that work for less than they get paid in China. So they're starting to build up their service sector, not just healthcare. Health demographics, people over the age of 65 in China, 122 million today. The average life expectancy in China is in the 60s. They expect 223 million by 2030. Approximately 1/4 of the Chinese population will be over the age of 65 by age 2050. What does this tell you about rehabilitation? This was our elderly services. A friend of mine, Mark Spitalnak, who left here in 1989, he's a lawyer from Colorado. He's married to a Chinese woman. He now has a Sun City, if you will, in China. It's the first Sun City that they've ever had in China. Why is this happening? Because these young urbanites, these young professionals that are working in the cities can't get back to the family household where they would ultimately take care of their elderly parents, but now they are trying to provide for them in these Sun City kind of arrangements. So this is taking off. Chronic diseases, comparing to the United States where we have over 27 million diabetics, they already have 92 million diabetics in China, and they're going up to 150 million. Guess who's going over there? Dece. Okay, Dece's spending a lot of time right now trying to open up clinics in China. Here's cancer and respiratory and even depression. Very badly underdiagnosed. It was estimated in 2007, 2 million new cancer cases per year. A lot of this is lung cancer due to the coal burning that they have in these cities, but facilities could only handle 400,000 patients as of 2007. So I was working with an oncology group out of Irvine, California, and we were going to put a hospital in pretty near Shanghai. Why? Because the Chinese government was going to say, no equity partners need, we need you yesterday. We need oncology care. Please come over here. Okay? So that's an example of how they're asking that we get over there. Opportunities, real quickly, pharmaceutical. You can see the numbers here. It's amazing what's going on in China in terms of their consumption of pharmaceuticals. Now, the way the hospitals work, physicians on average make about $6,000 per year in salary in China. That's starting to jump. They're starting to get some physicians up to $11,000 and $12,000. But it's nothing like what we see here in the States. Matter of fact, medical school in China is free. They're trying to entice people to come into medical school. Today, still, people are trying to get into business schools because that's where the money can be made, manufacturing, etc. So the status of the health profession is nothing in China like it is here in the United States. They want that to change. So what goes on in Chinese hospitals are that people have been paying fee-for-service. Now they're covered to some extent by insurance with high co-pays. But how do doctors make extra money to supplement their incomes of, say, $6,000 a year? A lot of it has to do with giving everybody an IV that walks in the door, okay, or giving a lot out in terms of drugs and prescriptions. Approximately 8 to 10% of our cost of hospital care in the United States is pharmaceuticals. In China, it's over 60%. So they're over-prescribing in China. So doctors can make more in terms of supplemental income relative to their, say, $6,000 or so a year. Anyways, this is a great opportunity for pharmaceuticals. And you see all of these American companies over there. I think the best way to understand that is we have more American multinational sales reps from pharmaceutical companies in China than we have in the United States right now. So if you're going to go work for Pfizer as a salesperson, you're more likely to be working in Kunming or Shanghai or Guangzhou than you are to be working in Philadelphia, LA, or Chicago. Okay, so they're all over there. And as I mentioned, the Chinese hospitals are putting our drugs into their hospital formulas, so they're buying American products. So in terms of pharmaceutical care, it's a done deal. This is a great market. All of our American multinational corporations are over there and expanding quickly. which brings us to medical devices. Pretty much the same story. You can look at the numbers there. Market size has gone from 8 billion to 20 billion in 5 years. That's a doubling. They're buying quickly. They're buying all the state-of-the-art medical device equipment that they can buy. I've toured a plant now twice that makes MRIs for GE. That's in Shanghai. And it's very interesting as a business school professor to walk in there and see all the quality teams and all the leadership and all the different management skills that we talk about in our business schools being deployed there in their manufacturing sites. So our medical device manufacturers are all over there. Tremendous opportunity. Matter of fact, if you're not over there right now, you pretty much sort of missed the whole bandwagon. Here's what's going on in terms of health reform that they put in place, as I mentioned, in 2009. They are building new facilities, 2,000 county hospitals, 2,400 urban hospitals, 3,700 community clinics, and 11,000 urban clinics. So they're not just giving people the means to have health insurance to go to see a doctor. They are also building up clinics much closer to their homes, etc. And of those standing hospitals, and there's over 17,000 hospitals in China, as opposed to our 5,000 or so here in the United States, they have added on. Every one of those hospitals has had an addition or two put onto the hospital. So what does this mean if you're a medical device manufacturer? Tremendous opportunity. They're putting up their bricks and mortar, and now they got to fill those bricks and mortar situations with various medical device pieces. Insurance, the story isn't as compelling as it has been with medical devices and pharmaceuticals, but as they've gone into universal coverage, they've had to develop a health insurance industry, and quite frankly, they didn't have the capacity to do that, so they've had to bring in a lot of our insurers to help them set up actuarial tables and things like that to understand how the insurance industry works. So that's been a pretty impressive opportunity also for American insurers. And this comes to where I want to go, and that is health services, hospitals. Okay, as I mentioned, it's still a pretty domestic industry, but it is becoming much more international here in the States. I'm even hearing stories, and I don't know a lot about it yet, but I'm understanding that the Anschutz campus wants to become a bit of an international medical destination facility. And I know, say, Dan Ritchie and people like that are sort of involved in this movement. Maybe Steve knows about this, I don't know. You ever hear anything about that?
Yeah, I've heard a lot about it. And you know, the challenge with this is if you want to compete, it's like any business. If you want to compete, you have to be capitalized, and you have to have the marketing strategy, and you have to, when people come here, have the services that are available, which is translators, cars, and you have to have the systems in the hospital, because these are people that are used to being taken care of, having everything taken care of. And the challenge is, before you have the volume, how much cash are you willing to burn if you're not sure that you're ever going to have the volume? And I think that's been the challenge that both University Hospital and Children's Hospital have faced.
Right. But the point is that here, even in Colorado, they're trying to become sort of an international destination, just like these hospitals in China are trying to become international destinations. Today, or as of last year, they now have 33 hospitals in China with Joint Commission accreditation. It's called Joint International. That's out of both Terrace and Illinois. This is, the Medicare qualifications that you have to have here in the States. They only had 3 hospitals as of 5 years ago with that kind of qualification. Why do they do that? So they can show that they're world class, they have all the properly trained people, they have the right medical devices, etc. And this isn't just obviously happening in China, it's happening everywhere. It's happening in the Philippines, Indonesia, Singapore, Kuala Lumpur, what have you. So here's the Chinese hospital. I mentioned over 17,000. Basically, their management systems are terrible. And I can say that because I'm in the MBA health program as a professor. You go in there, they don't have management systems. They don't even understand what we're talking about. They may know the words, but they don't actually have anything in place. You go in there and ask to see an organizational chart to find out where the departments are and who reports to who. They don't have that. They don't have any governance. They don't have trustees. The hospital administrator inevitably is a physician. Nothing wrong with that. However, that physician doesn't have any training in hospital management, and that physician has rotated in there on an annual basis, and that physician, as a hospital administrator of, let's say, a 500-bed hospital, is still seeing patients 50% of his or her time. That's because they don't understand what skills are necessary for hospital administration. As a result, they don't know what their cost centers are in the hospital, etc. This is changing quickly, and this is the reason I've been teaching in China over the last few years. Because with health reform in 2009, these hospitals are being asked to start competing. They're not just going to get their annual budget, but they're going to have to start competing for that annual budget to some extent. They're allowing prices to change among hospitals, so you don't have a standard price for a certain care throughout all hospitals, but if you have, for example, a center of excellence, let's say in sports medicine, you can have higher prices, and therefore you can start bringing in higher priced or higher salaried physicians. Well, that means you're going to have management systems in place, number one, to make it good, and number two, to actually do the accounting and finance to find out what works and what doesn't work. You're going to have to do things like marketing of services, etc. They got a long way to go. They recognize that they have a long way to go, but they're making the movements in that direction. So that's the reason they're starting to develop, and Steve mentioned this when he introduced me, sort of the software, if you will, of the health industry. They have the bricks and the mortar. Now they're trying to develop the health management professional people to actually carry it out. Here's sort of another comparison of U.S. and Chinese hospitals. You go there, you stay in the hospital much longer. Here we're trying to kick you out as quickly as we can. I don't know what else there. Accounts receivable. They have no accounts receivable. At least they used to not have accounts receivable. That may be changing now with health reform. But basically, if you didn't have the money, you didn't get in the hospital. Okay? Here, through your whatever, Medicare, Medicaid, or private insurer, you're going to be having a bill, accounts payable, all that kind of stuff. Here's what I mentioned before about pharmacy as a percent of total revenues. I actually said 8 to 10% in the U.S. I guess it's 18%. Limited management capacity, no governance structure, administrators aren't trained, no chief financial officer. I'm just telling you all this because as an MBA health professor, I see this and I see, first off, a lot of need, also a lot of opportunity. System decentralization. What they have in China is they have primary, secondary, and tertiary care hospitals, and basically, due to lack of legitimacy and credibility, Chinese patients have a tendency to flock to the large urban primary care hospitals because they're afraid, if you will, of the doctors that might be working, for example, in the tertiary care hospitals. The Chinese want to decentralize the system. They want patients going to their local hospitals, but they may not have the health professionals there that are as capable as you might have the primary care hospitals. Here, you might go to Porter, you might go to Adventist, or what have you. But there, it's a secondary thought. You just sort of go to the primary care hospital. The physical plant, I don't know what to say about this. I'm not an architect, but I went in with some infection control people, and it's just amazing what they do there. All the ventilation's terrible, etc. They have no, well, I'm sure they have codes, but they don't actually have to maybe live up to them. This is changing. They're starting to recognize the need to do this. We have architecture firms, Gensler, et cetera, in Denver that are building hospitals in China. So they're trying to get this all fixed up. Patients per physician. You can see we have a lot more nurses and doctors, but they're trying to up this too in terms of their education. Physician practice, the doctors are employed by the state and they are employed by a hospital. They might have on the side, some care that they give in the evenings at their house or a clinic nearby. They are trying to change the salary structure. They're trying to incentivize people, especially their best and brightest, just like we have in the United States, to go into the medical fields by increasing salaries, etc. Now, we did a study. Actually, this was our first study. I did this with China Care Group, a consulting firm out of Beijing. It was actually the first study that we knew of health facilities in China. And the question we asked, and the wording's sort of not actually great English, but it's what we put into the survey, is we were asking the people in 3 cities, Guangzhou, Shanghai, and Beijing, whether they thought joint venture, that is, as westernized hospitals, are better at delivering care than the Chinese hospital, the state-owned hospital. And you can see by the large size of the red bar that basically they thought the joint venture hospitals were better in terms of their facility, in terms of their personnel attitude, and lastly, in terms of technique. Now, we didn't expect this. We expected technique to be the primary reason people were choosing joint venture hospital. They wanted to see Western physicians because allopathic medical care had been proven to be more effective, and therefore they wanted to have the best procedures. But here we're finding that they actually just don't like Chinese hospitals because they're so crowded. You have to wait in line. They have the red envelopes that you have to pay to move up in the line and all these other things. So as an MBA health professor, it's actually that second thing, personnel attitude, that remind me of the tremendous need there is for hospital management education in China. So here's to sort of break this down a little bit, long waiting lines. Sometimes you have to wait over a day to see a doctor, bad personnel attitudes, qualifications of doctors, etc. So this really isn't about technique, although that is of interest. It's more about just concierge services, having a little bit more customer satisfaction-oriented care. And that sort of reemphasizes that. Now this is sort of hard probably for Americans to understand, but in China, when there's a bad medical outcome, you often don't call up your lawyer, or in the U.S., I suppose you'd call up your lawyer and you'll file some sort of suit and maybe get a malpractice claim. But in China, you basically maybe hire a group of thugs to go hit the physician with the baseball bat in the parking lot. And it has led to a lot of violence, and it is increasing on an annual basis. So this is how it's actually a security concern. And I actually have seen this headlines in the newspaper, please do not harm your physician. It's not ultimately their, how they delivered their care that led to a bad outcome. Here's an article I saw in the New Yorker magazine this summer. This reporter was over in China. I can't remember where he was. Oh, there it is, Yunnan province. And he went in with a rash, okay? And he went in, and this is the progression of things that happened to him. When he first went in to see the doctor, many other patients and the janitor gathered in the room to hear what his prognosis was. So there's no privacy, okay? The first prognosis was that his rash was due to the air in Yunnan province. And then he said, well, I've been living in Yunnan province, but I've also been living in Beijing, and there's really no big difference, so it can't be that. So he came back another time, and the prognosis was it was due to the spicier food in Yunnan province, that is his rash. He said, now wait a second, I've been eating in Yunnan for the last year or so, and all that kind of thing, so that can't be it. Then he came back a third time, and the prognosis was because of different water in Yunnan province, that's how come he had his rash. Okay, so finally, what he's trying to point out here is these physicians at this particular hospital really didn't know what to do. They didn't have any sort of regular medical diagnosis of what was going on in his case. And he's just trying to point out that in lesser hospitals, you have often very unqualified physicians. So here in the States, through the Flexner Report in 1910, we have medical education. It's very highly standardized. It's very regulated. People that come out of medical school here have very strong educational backgrounds. In China, you often have people that have come out of high school that have maybe gone to medical education that included working on a cadaver for 6 months, and then they hang their shingle, and effectively they're almost quacks. So the Chinese recognize that they have a lot of quackery, if you will, in terms of the medical profession. The Chinese need to clean this up. They need to clean this up in terms of patient care, but they also need to do it in terms of decentralized in the health system, having good doctors everywhere throughout the system. So then the question becomes, will hospitals, these international health service organizations from the United States, actually make it in China? And it's not just the United States going in there. The French are in there, and other countries are in there too. But we're looking, many of our corporations are spending time looking into other markets because profits in the United States are limited, maybe 1 or 2% profit lines today, and they can look into some of these other markets such as China and India or what have you, and recognize profit margins of sometimes 25 up to even 40% if people will pay. And that's the big question for China. So I personally right now am working with a corporation that has hospitals in 25 nations around the world. This is an American-based corporation. They still aren't in China. They're still not sure when they're going to go into China. They know they will, but the question is when. And the question is why? Why would they go in there now if the Chinese aren't used to paying Western prices, or at least something closer to Western prices for the kind of care? If they don't have a strong appreciation for Western care, and they don't pay much for care in China, how can an American concern walk in there, charge not maybe the prices we'd have here at Children's Hospital, but still higher prices, and have the Chinese demand those services? So that's a big question. As a consultant, I tell people, I say, it's not as simple as looking at 1.4 billion people. It's not, don't just look at the size of the market and the increasing disposable income. Look at what they're used to getting, because it's going to take a while. So there is an increasing appreciation for Western healthcare technique. There is an increasing willingness to pay for certain services, such as birthing care, maybe oncology care. There is increasing interest in Western standards. Here's what I mentioned earlier about the accredited hospitals. A lot of hospitals are trying to come up to Western, being equivalent of a Western hospital. Pricing comparison, I'm looking here at Beijing United, which is a hospital I've worked with out of Beijing. It's actually on our New York Stock Exchange. Chindex is its symbol. It has now hospitals in Shanghai, Beijing, of course, and I can't remember the third city. But anyways, their maternity care, which is basically Western technique, actually American physicians, are the obstetricians and what have you, and their costs are about $5,800. As opposed to a birthing care at a hospital, a regular hospital in China, which is $400 to $700. Now that's a big gap. Okay, say $700 to $5,700, $5,800. Are you, as a Chinese person, even though it's a one-child policy, you're very interested in having a good birthing experience, willing to put that extra $5,000 on the table just to get Western technique and to get better care in terms of customer service and things like that? It's a difficult question. And today, Beijing United is starting to see more Chinese patients, but they're still relying to a greater extent on expatriates working with multinationals and also governmental employees. So just sort of going back, what we're starting to see is the Chinese are starting to do more private consumption. The government's trying to get people to quit saving so much money and putting it away in their beds or what have you, and trying to get them to be more consumer-driven. This is good for their economy, just like it's good for our economy. If anything, we're probably too consumer-oriented in the United States. In China, there probably need to come a little bit more consumer-oriented. And they are buying top-level kinds of products. The iPhone 6, as I mentioned, has done very well there. Wines do very well, and other things are doing very well there. But healthcare isn't seen as one of those Western products yet that people are becoming more inclined to purchasing. Here is, I can't remember where I got this. This could have been Price Waterhouse, but basically they looked at the changing demographic nature of households in China from basically 2012 to 2030. As income increases in China and they become more Western, if you will, you can see their movement from sort of aspirant in terms of buying Western products to more global affluent and mass affluent, buying more Western products, especially service products such as healthcare. So there is reason to think that there will be many more people buying Western healthcare technologies or technique. So I wanted to end with the case study. This is going to bring in the management side, the kind of thing that you would hear a lot more about in a business school. Business schools are pretty much driven by case studies, and in case studies, hopefully you can sort of pull out some of the main ideas as to what drives and what doesn't drive business. And these are going to be two companies, which I've changed their name. I'm still under non-disclosure agreements with, but I've changed their names. One is based out of Colorado, as a matter of fact. A young man, fairly young man, he sold his business that made a software product, and he received a $75 million, he sold it for $75 million. But he had a non-compete here in the United States for 10 years. And this was a healthcare IT product. And so he decided he's going to go into China and start a health system. Pretty ambitious. And so he got a lot of things lined up. It was just amazing what he did. Now, he's a former West Point person. He has a lot of friends in the military, etc. And he was able to get Columbia HCA out of Nashville involved. He got some of the top Chinese physicians involved. He was going to aim at the upper middle class to high-end Chinese market, but basically expatriates and multinational companies. He was going to develop centers of excellence. This is an idea they really haven't come to yet in China. All their hospitals are sort of general services, but they're starting to come up with the idea of the centers of excellence. He's going to have cardiovascular care, diagnostic and interventional centers, general and family medicine, neurosurgery, reproductive health, etc. So he was going to have these centers, and he was going to sort of have a hub and spoke kind of health system. In China, all these hospitals are sort of independent. They all have their budgets that they get from the government. Here we're going to have a referral kind of system where he's going to set up some small hospitals that feed into the large major hospitals in Beijing and Shanghai. Now, this is his business plan. This is what he was trying to sell to various venture capitalists, etc., in terms of going into China. And to some extent, I have to admit that he was quite successful in getting money. So he didn't really end up spending a lot of his own money. He was spending other people's money to develop sort of a Western healthcare system like we have in the States and sort of implement it in China. So that's case study number one. Case study number two is a little bit different story. This is, I'm going to call it proactive Medicare. And in this case, it was based in Austin, Texas. The person that was in charge of it came from a Chinese background. He was Chinese American, and he used to be the chief strategist for HCA Columbia in Nashville, Tennessee, back in the mid-90s when, for example, the city of Denver went from 13 independent hospitals to health systems like we have today, such as Health One and Centura and the university system, Exempla, etc. A lot of that consolidation was done by HCA Columbia, and this person in particular led that whole strategy. So he decided he's going to go over, since he's Chinese, with his brothers who lived in Hong Kong, and set up a Western healthcare technology or healthcare system in China. His approach, though, was much different than what we saw with Capitus. He was going to try to start within Chinese hospitals. Why? Because the Chinese are familiar with their hospitals. They're not familiar with an American hospital. So he's going to try to set up a private unit within a public hospital. Now, why would a public hospital in China be willing to do this? Why would they allow for a private unit? Well, number one, it brings some legitimacy and credibility to the hospital. It's going to probably improve technique because they're going to be bringing in some Western physicians to help spread the ideas of better procedures, etc. And also, it's going to supplement physician income. These physicians in China want extra income by taking on private patients, paying for private health care. They're going to be able to increase income. So his idea was to start with sort of clinics first, that is, his private units within public hospitals, and then ultimately maybe have a private hospital or two. This is, once again, different than that hub and spoke system that was going to be set up by the Colorado concern. So his goal was to be more about acceptance in China. The other person was trying to bring in Western healthcare technique and sort of pick off those people with a lot of money that wanted Western healthcare technique. Here, he's trying to fit a brand name and sort of an identity in with what's already working in China in terms of their cultural, in terms of expectations, etc. So his costs for maternity care at his facilities was about half of what Capitus was going to offer at their facilities. So it's a little bit more available, if you will, to middle-class Chinese, not just the top-end Chinese. So he's not really focusing on expatriates and high-end Chinese in terms of income, but actually more of a middle-class approach. So just comparing these two cases, here's Capitus out of Colorado, and they want to become an international hospital with joint accreditation, very much like an American hospital in China. Excellent management team. They had top surgical teams, etc., from Phoenix and Irvine, etc., involved with this. It was a hospital-based strategy, not clinics for the most part, but things feeding into these main-end hospitals, aiming at the high-end market, expatriates and very high income earning Chinese. Proactive medical care was a little bit more of a hybrid approach. They're coming in as sort of an American CERN with a Chinese orientation. They're going into the public hospitals with a private unit. They also had an excellent management team, and their management team, for the most part, came from Johns Hopkins. They were using obstetricians and gynecologists and other people from Johns Hopkins. They were bringing Chinese physicians over to Baltimore, and they were training them, and then they were taking them back to run the hospital. A little bit more of a clinic-based strategy leading to hospitals, and their market was aiming a little bit more at the middle-class Chinese person. So which one do you think worked? One of them failed, one of them didn't. Which one do you think worked? Who thinks Capitus did well? No. But thanks for voting. Proactive medical care? Thrived, absolutely thrived. Okay? So what happened, and actually, this is my last slide. Here's the first day of the opening of the maternity unit at International Peace Hospital in Shanghai, which is where this private unit was set up. You don't see anything here in terms of care, but you can see in the background the fixtures, etc., very Western, very updated, etc. They had 23 beds, private units for maternity care in this facility, and every one of them was filled up here on the first day. And after a few months, this is the fellow from HCA Columbia that was head strategist. This is a fellow named Joe Swedish. You remember Joe? Yeah. He used to run Centura. He happened to be in China at the time, so he was involved with this whole thing. This is my RA at that time, research assistant. And this concept, along with his brothers, this fellow was able to start doing the same thing in many other hospitals. He got into 3 or 4 other hospitals within 2 years, and every one of them was doing very, very well. So he was developing a brand. He was developing experience of working in China. This is going to take him a long way. The Chinese citizens, the middle class and upper class, were using the facility, so he was setting himself up for the long term. Unfortunately, this story took a tragic turn when he got off the plane in Baltimore about 3 years after this picture at Johns Hopkins. He was short of breath, so he went in and had some testing done, and he was level 4 lung cancer, and he died about 60 days later. So all of a sudden, boom, that sort of went up. His brothers now run this out of Hong Kong, and I'm not involved anymore. But it's what this case study illustrates is you can't just go in as a Western concern and assume the Chinese are going to buy it. As a matter of fact, they aren't. Okay? They are starting to be much more aware of better healthcare technique. They want better service orientations. They want hospitals that are clean and pretty and all that kind of thing. But they're still Chinese, and they want more Chinese-related concerns involved with that whole kind of thing. So is there an opportunity for American firms or other Western firms in China? The answer is yes, and this is increasing and will be even greater in coming years, especially as Chinese income continues to go up. However, there are certain ways to enter that country that will take some time, and frankly, you're going to have to get to know Chinese culture and the people and work accordingly if you're going to be successful. And that's probably true in any nation, but maybe especially so here in China. So, I guess there's 5 minutes.
The other thing is that there were hardly any children's hospitals in China.
Right.
And in addition to the number of, they were wanted to build like 40 or 60 brand new major children's hospitals. And the challenge is that they approached children's and a lot of other children's hospitals to help them with those new hospitals. But the Chinese are very good at asking for help and saying, we're a developing country, donate that help, even though they could buy and sell us many times over, right? And so it's really been an interesting dynamic of, okay, you know, they need to build these children's hospitals, they need to get things right, but what is the mutually beneficial outcome for children's hospitals in the United States to partner with the Children's Hospital in China? Can you comment on what from that perspective?
Well, I think, you know, once again, I work with this group called China Care Group, and they're now owned by Price Waterhouse. They're now based down in Hong Kong. They used to be up in Beijing. So they're the ones that actually work with Western groups like, say, Children's Hospitals out of the United States and about coming into China and how to maybe do that. And I think what they tell people is expect 4 to 5 years of losses. You have to develop a brand identity. You have to develop familiarity and credibility and legitimacy. And then after that, you might see some profits and maybe extensive profits in the long term. But it's hard for a children's hospital out of Colorado or St. Louis or what have you to take 3, 4, 5 years of losses to get to the point where they can be profitable.
The other group, that you may know them here, they wanted to develop rehabilitation hospitals because there was no rehabilitation work that was in China. That dropped off my map, my radar screen. Do you know what's happening with that?
Yeah, I'm not. I mean, is that Craig or is that? Yeah, is that Craig Hospital or?
No, it wasn't Craig. It was actually. It was actually some friends of some docs at Children's that were Chinese that were trying to put it together.
Yeah, I'm not familiar with that. No. I guess the bottom line is there is tremendous opportunity in China. Just what about today? Or can you wait 2 or 3 years or 5 years to really take advantage of the opportunities? Lynn?
Have you written an article or are you doing a book on comparing your experience in Haiti and China?
Haiti and China? I'm not even sure how to. We have 3 or 4 articles that we published on Chinese hospitals, and with the consultants that I've worked with in China, and and they've got a lot of play. They've got a lot of people interested in talking to me about. But comparing China and Haiti, I'm not sure I can. That's almost too much for me to handle. So.
Hey Blair, it's always interesting to me, and I'm going to give you a hard time as a woman in the 60s, that when I see a slide, first day at Proactive Medicare's maternity unit, and it's 4 men.
Well,
What's wrong with that picture? And I think what worries me, and I know you're presenting the business case,
right.
And I fully understand that this is about business.
Right.
But starting with an American model for maternity care has not been shown to be the most cost-effective way to provide quality maternity care. And it needs to be interdisciplinary, and women need to be represented. So if I were you, I would change that slide.
Put some wigs on it.
Do something.
Maybe I can Photoshop a
In
picture.
China, the majority of physicians are women.
I know that.
Yeah.
Majority of physicians.
I
And
realize
I think like
We should have the obstetricians that were involved with that in that
90%
picture.
Well,
pediatricians
but where are the
and
nurse
obstetricians are women.
midwives?
Actually, I don't think there were any nurse midwives in that
And
maternity
see,
unit.
that's one of my issues, is that we have demonstrated in the United States we provide the most expensive maternity care in the world.
Right.
and we don't have outcomes that show that investment is worthwhile. And it's because we don't provide interdisciplinary care,
Right.
which is really founded on beginning with the nurse midwifery model. And WHO and everybody else has gotten on that bandwagon. So it just grieves me to think, are we bringing in what hasn't worked well and is extraordinarily expensive in the United States to a developing country in the name of business?
Good points. Good points. I accept all those criticisms.
Stop like Guatemala.
I'm gonna Photoshop some nurse midwives into that one picture. Okay, thanks, Steve. Please.
So you had a lot of good slides on the healthcare delivery and certainly the amount of infrastructure investment, but I'm concerned about the integration of health with healthcare and where they are, because you've got an aging society, tons of diabetics.
Right.
So what are they thinking about in terms of making sure they just don't create a bigger funnel of people who are getting more chronic disease in an aging society? Same problem we've got.
I'm not sure. I'll open that question up to anybody here. I don't have an answer to that.
Is the government making any investment at all on that sort of front, on the public health front, on the social?
You know, based on the conversations I've had with people that deal with the government, they still see healthcare as sort of a secondary kind of issue for them. And yes, the Chinese Hospital Association, et cetera, of talking about preventative services and things like nutritional care and all that kind of stuff. But the Communist Party, this is once again based on what they've told me. It's not like I have direct knowledge. Doesn't seem to be as aware of that as we might be in the United States. You know, they have obesity problems, and now they have diabetic care and all these other things. And
55% on drugs isn't going to solve the problem.
right. Right. Yeah, and they don't want to repeat the mistakes we've made either, you know, so they read up on our stuff and they're trying to come to terms with it. But it's just, I think one way, it's really like 30 years ago in America or something like that. They're catching up, and they're catching up fast, but they aren't where we are today in terms of an understanding of preventive services. Molly.
Thank you for your question. I'll help you think through some things. With the two case studies that you presented, it was clear that the cultural acceptability was kind of the defining feature.
Right.
In these consultation services, are there behavioral scientists or people represented from an anthropology field that can help make that transition smoother?
We didn't have any answer. You know, once again, I was just on the outside sitting in on that case study. Okay, is he working with the anthropologist to get a better cultural understanding? Actually, once again, I'll just say his name. His name is Herb Wong, and he's also got a PhD from UC Irvine, and he used to be head of strategy at HCA Columbia. Did he have anthropologists involved? No, but his family, was very involved with this. So they understand the Chinese person probably much better than the capitalist group did.
Right. I'm curious to know how the cultural sensibilities are accounted for when you're trying to implement something. And, you know, during that phase of losses, it's like, what can we do to shorten this period of time and really become culturally accepted?
Well, I can tell you that when Herb and Joe and I were sitting down, and he was describing what he was doing, this is about a year before this picture was taken, he said the most important thing isn't so-called a technique, it's actually acceptance within China. So he gets what you're talking about. He wanted to start within a Chinese institution that was well-known and respected, and also supplement what was going on there with, more income and some other things. So the Chinese would appreciate it, and they could develop a brand identity, and a brand identity that would have a really positive association. So you can see all the business school stuff coming out in this. How do you develop a new product in a new market that's going to be accepted and appreciated and ultimately wanted by many more people? So he may not be an anthropologist in training, but he certainly seemed to be aware.
Well, and I think about it too in terms of increasing the value of public health thinking, right? Like, how do you connect those things?
Yeah, I don't know. Gretchen, have you worked in China?
No, I haven't. Vietnam, yes, but not China.
Well, how do you get cultural, that's right, you've done all your work in Vietnam. How do you get cultural acceptance over there for some of the things that you did?
Well, of course, continuing discussion and exposure, but I would say from the Vietnam experience, also the willingness on the part of development workers and health workers to overlook what seem to be blatant barriers to us as Americans. For example, when we worked in Vietnam with the development workers and with the Vietnamese doctors, many of whom have been in the Vietnamese military, and what they wanted from us was cigarettes. and then we wanted to drink their tea, and it would take as much as 7 visits to a given town or village area. And each time it was expected that we would bring cigarettes. And I remember the development worker there was one of the leaders of the Positive Deviance movement, that he said to me, "Gretchen, I know you're from the Harvard School of Public Health. We are bringing cigarettes. Now, if that bothers you, go home." But in the end, by being willing to just ignore some of the blatant differences, but concentrating on the health of children, we won friends, and we eventually had a very highly acceptable program that was even copied by the Ministry of Health and adopted by the Ministry of Health. But when I think back on that, it was just so offensive to me, bringing cigarettes to every meeting in every town and village. And sometimes I think we have to be big enough to think about the children in that case and forget the cigarettes for the moment. So that's just one experience I had working in Vietnam.
Yeah, and there's certainly a lot of smoking in China too. And matter of fact, you see it in their Chinese hospitals. Chris?
So I was just wondering, compared to T.R. Reid's work from a few years ago, are there any best practices or learnings that you can bring back from your experiences there?
Well, actually, I think this case study of Herb Wong is taking a little bit more anthropological approach, trying to fit in, and maybe even fit in with the cigarettes in Vietnam, fit in, and then sort of develop and progress from there would be a case study, or a case for T.R. Reid to consider. There is tremendous opportunity here for American businesses. And ultimately, the Chinese, as I mentioned, really want healthcare to drive their economy in the future. Services, it's job-oriented. They need to come up to higher standards, and they are using American concerns to try to get to that level, as well as other concerns too. And, so there's a little bit of give and take, though. You might have to give cigarettes to the physicians, but in other words, you can also bring in a lot of techniques that will allow them to move forward too. So, please.
My question is the health opportunities in China are open not only to the United States, but also to other Western, especially the European countries. So how do you see the position of the United States, hospitals, in this competition?
I've actually thought about that quite a bit, and I'm not sure I have a big enough picture to understand, but I know the French are over there in a big way. And to some extent the Japanese, but the Japanese aren't too highly perceived in China in some manner. And the Canadians are there, and I've seen some Russian entities trying to set up shop in terms of healthcare in China. But I still think the Americans have a little bit of an upper edge. The Chinese perceive our medical education and all these leading multinational corporations as sort of the top end. And therefore, the Chinese have a tendency to sort of aim for the top and bringing in the best of the best. And so the Americans seem to be doing quite well when it comes to competing with these other developed nations trying to get into China. At least that's what I've been told. Maybe they're saying that because I'm American and they're trying to make me feel good. But I think there's probably some truth to that. So.
How has, given that this is the potential for job growth, how has changes in terms of staffing, training, these kind of things, has there been an influx of something else coming from other places there too?
Yeah, if you want to go over there and teach HR right now, bingo, you got a job. You and I could go over there tomorrow and have a job, teaching a lot of the things that we teach in the business school, especially if it has a health orientation. So they get it. They know what they need to do. When I was teaching for Yale in China from 2009 to 2013, there was a grant from the Goldman Sachs Foundation out in New York City. They were trying to help the Chinese come up to speed in terms of hospital management. And we started with the secondary hospitals, hoping that they would take it to the tertiary care hospitals, etc. So yeah, there's tremendous need right now for that kind of education.
Could you debrief the Capitis failure? just a little bit? I mean, so how far did they get? Were they actually?
They opened up, they opened up a clinic right outside where the Olympics was put in place in Beijing, and it's not too far away from United Family. You probably don't know that part of Beijing. But anyways, they were in sort of a high-class expatriate environment in Beijing, and the clinic wasn't doing particularly well. He had primarily Chinese physicians and nurses, and so he was staffing it very well. They had all the right techniques, etc. He wasn't meeting the business goals that he had put into his business plan, so some of the venture capital started being withdrawn. And then finally he had a bit of a problem because his wife left him here in Colorado because he was spending so much time in China, so he sort of stopped it. He stopped the process. And today he's living up in the mountains, and I've asked him about 2 years ago through his brother if he might come here to the university to speak about his experiences in China. I should also mention, he worked with numerous other concerns involved with healthcare entree businesses into China, and there was a lot of corruption actually by the Americans that he entrusted as opposed to the Chinese. And so he sort of got taken by some Americans who also happen to live in the Colorado area. I'm trying to avoid any name association here. So he finally, after 3 or 4 or 5 years of this, sort of walked away. And as I say, he was a very smart man, very ambitious, worked very hard, and he was smart to be using other people's money, not his own. So he still has a great deal of money. I don't think he has any intention to go into China again. I asked him to speak in the business school, and he said, give me another year or two to sort of settle down. It was a difficult experience for him, to say the least. So, anyways, I appreciate everybody coming here. If you have any other questions, I'll be hanging around for a few minutes, so thanks.